I hope I'm audible and visible to all of you. Welcome in this session of Dermatology with me, Dr. Chesta Aggarwal. I'm your NEET PG educator on the best online platform that is Unacademy. Now, we for this month, the NEET PG free test calendar is here. I request everybody to try attempting these free live tests. We have two type of subscription. One is Plus, which give you an access to Unacademy live classes from the top educators, and Iconic give you an access to both Unacademy and Prep Ladder together. Now, only 2 days left. The 20% discount is present right now. So the offer is only till 16th. I request all of you to please use my code. My code is CHESTA10. Requesting each and every one of you to please get this subscription. You can get 20% discount on any of the Unacademy subscription, whether it is a short subscription or three longer subscription. So requesting each and every one of you to kindly use this code to get your Unacademy subscription today. Congratulations to those who have cleared the FMG exam. We have two type of classes. We have special classes and we have paid classes. Special classes are free class. Today I have a session at 10 p.m. I request all of you to please be live. Many new batches like All Educator NEET PG 2022 batch and FMG batch starting on 16th. Requesting everyone to please be a part of it. Now we have, this is the subscriptions which is available. I would highly recommend all of you to get the referral code CHESTA10 and get 20% discount on Unacademy subscription. Starting with the first question. So we are discussing the FMG PYQs. We have started this FMG series and I'll try to continue this series for the remaining days of this month. So requesting all of you to kindly answer. A female student presented with urticaria. Following intake, what is the correct answer here? Following intake of seafood, she wants a non-sedating drugs because this is our exam time. So which of the following is the correct statement for this question? Anyone can tell me the answer here? Okay. Now the answer to this question is option number 4 because the only non-sedating antihistaminic or less sedating while the first generation antihistaminic they are usually sedating. First generation antihistaminics are usually clear. So try to remember these two features that the second generation are non-sedating and that is why we do prefer it whenever we need a patient or whenever patient needs something which is non-sedating. The next question is on your screen. I hope it is visible. Let me just move the image on the top so that it become very easy for you to. What could be the diagnosis for this image? This is a PYQ from FMG exam. What could be the diagnosis here? Alopecia areata, Telogen effluvium, Trichotillomania or Anagen effluvium. What could be the diagnosis for this particular image? Amazing, all of you. Now, if I zoom this image, you can see that there's a well-defined patch which is present on the scalp. Can you see this is scalp? And we have a well-defined patch which is present here. This is very, very classical of alopecia areata. Now, a little bit about alopecia areata. It is an T lymphocyte mediated disease. If this is the hair, you see T lymphocyte directed against the pigmented part. So these are the T lymphocytes. Now, because of presence of these T lymphocytes, The hair will taper like this, and this tapered hair is known as exclamatory hair. What is the clinical presentation of alopecia areata? You will have a patchy hair loss. You will have a patchy hair loss. Very, very classical. You will have a patchy hair loss. So the answer of this question is alopecia areata. Next question. Next question is on your computer screen. Patient who is farmer or gardener by occupation presented with the following lesion. What can be the diagnosis? You can tell me the answer. I can zoom the image for you. A large tumorous growth present on the foot. What is the answer? This is a very classical example of mycetoma. Now, mycetoma has a very characteristic triad of tumor, discharging sinuses, and what else? What is the next? Which are nothing but the fungal elements. Now, we have two types of mycetoma. Eumycetoma and another is actinomycetoma. One is eumycetoma and another is actinomycetoma. In eumycetoma, what will we have? In eumycetoma, we have a slowly growing tumor which is more deforming. We have black color grains, and for treating this we need to give antifungals. While in actinomycetes, please remember it has a fast growth, it is more deforming, fast growth, more deforming. The color of grain is usually yellow or red, and we need to give antibiotics. A very popular regimen which we give for actinomycetoma is a Welch regimen. So the correct answer of this question becomes option number 1, that is mycetoma. Next question is, or this is the image, how the type of fungal infection. One is chromoblastomycosis, where you have a verrucous growth, and sporotrichosis, where you have a linear growth along the lymphatics. So you have all these features which you need to remember. Moving to the next question. Moving to the next question. 70-year-old patient developed the following lesions over the face since 2 years. What is your diagnosis? What is your diagnosis? Amazing. The correct answer of this question is basal cell carcinoma. You can see that the common site is at the inner canthus. You can see a ulcer. Initially, there is a nodule which then form an ulcer. You can see the beaded margins here. This is a very classical rodent ulcer. BCC usually occurs over the sun-exposed areas, that is over the face. Along with that, you have to remember that it's the most common tumor of the skin, a very slowly growing tumor It will neither metastasize through blood nor through lymphatic. It will remain localized for a very long duration. Next question is on your computer screen. What is the likely diagnosis? A young lady lesions in the oral cavity, proximal nail fold have extended onto the nail bed. What is the likely diagnosis? Psoriasis, geographic tongue, lichen planus, candida. Amazing. This is a case of lichen planus. Clinical lesion of lichen planus have 5 P's. Cutaneous lesions, they are polygonal, pruritic, purple, papule, and plain top. In cutaneous, you will see a very classical reticular type. While on nail, you will see what is known as dorsal pterygium, a very specific feature. Dorsal pterygium. Next question. A patient presented to the health facility with the following lesion. What can be the diagnosis? What can be the diagnosis here? Here, of Ito, segmental vitiligo, nevus of Ito, or Baker's nevus. Which of the following is the correct answer? Very nice. Basant, Shri, Afsa, Petri, Rakesh, Shri Ramya. Anybody wants to answer this question? Pancake. The correct answer is segmental vitiligo. As we have already discussed that the midline is never crossed and it occurs on a single dermatome. It occurs over a single dermatome. It occurs over a single dermatome. Clear all of you? Identify the condition shouldn't be made. So remember that in these sessions, which we have started from today, the FMG series, I will be discussing all the PYQs. I'll try to discuss as many as PYQs as possible. And we will try to finish up with all the 5 to 10 year PYQs before your exam. So I request everyone to please be live for these sessions. Yes. So these are the questions from the this 2020, I think June 2020 paper. Yes, the answer to this question is option number 1, that is Condyloma acuminata or genital wart. Now, genital wart is HPV infection 6 and 11. Now, you need to know very, very important feature that what are the different type of warts. We have genital and non-genital. Cutaneous warts are of two types, genital and non-genital. Genital wart is because of HPV 6 and 11. We have non-genital warts. First one is common wart, which is also known as verruca vulgaris. Also known as verruca vulgaris. And it is mainly because of HPV 2, 3 and even 5. Second is not 3 exactly, but 2 and 5. We have verruca plana or plain wart. It is because of HPV 3 and 10. Then we have plantar wart, that is on the plantar aspect. This is because of HPV 1. So try to remember these. Now, Pancake is asking how to differentiate between Condyloma acuminata and Condyloma lata. So, for that, you need to concentrate on the image. Just have a look on this image. Can you see the verrucous lesion at the top? This is something like this verrucous. It is not smooth. I hope you can see multiple papillas coming out. This is a feature of Condyloma acuminata. While for Condyloma lata, it is always a flat lesion. Like the difference between Condyloma lata and Condyloma acuminata. With this, we are done with today's session. It was a short session of 15 minutes. I request all of you to please follow this FMG series for PYQs. We are also offering 20% discount with this referral code. So if anybody is interested in taking on Unacademy, it's a high time because on 16th we will have this offer, last day of this offer. So requesting each and every one of you to please get this subscription. Also subscribe to this YouTube channel, that is Let's Crack NEET PG. We have a Telegram group with the same name. If you like this video, please give me a thumbs up. Hit the bell icon so that you get all the notifications of my classes. Thank you all of you. Good day. Take care and